Hi, I'm Zachary Henry, and my research paper is an examination of the ineffectiveness of Alcoholics Anonymous. My paper argues that AA is not an effective treatment for alcohol use disorders due to its low success rate, spiritual framework, and uniform structure. Alcoholics Anonymous should not be considered the primary treatment for recovery, as personalized treatment approaches should be considered. I've explored alternative approaches that may provide more effective paths to recovery that will ultimately lead to a higher success rate of sobriety for those who are grappling with addiction. Um, Alcoholics Anonymous was established with the intention of providing mutual support for individuals struggling with alcohol use disorders. The 12-step program encourages its members to admit powerlessness over alcohol, seek help from a higher power, and make amends for their past behavior. AA emphasizes community and accountability, often fostering deep connections among its participants. Many critics argue that AA's spiritual foundation can be alienating for individuals who do not identify with its religious aspects. This has called for more alternative approaches that are more inclusive, evidence-based, and reliant on medical research and practices. It also has some mixed results as far as sustaining long-term sobriety. In fact, the dropout rate in AA is remarkably high, with research suggesting that about 40% of participants discontinue attendance within the first year. A significant body of research points to the limitations of AA's effectiveness. The biggest problem with Alcoholics Anonymous is that it's a very low success rate long-term sobriety. Although accurate statistics are hard to come by because of many factors such as anonymity and dishonesty. Most studies reveal that it has about a 2.5% success rate for over 5 years of sobriety. Putting all statistics aside, one only needs to ask around any Alcoholics Anonymous meeting to clearly see what the statistics are. At any given meeting, anytime, most people that are present are newcomers. AA's spiritual framework is another aspect that undermines its effectiveness for many individuals. The requirement to acknowledge a higher power can be alienating, especially for those who have had negative experiences with organized religions or who may identify as atheist or agnostic. Studies have shown that the spiritual component can lead to resistance among potential members, limiting their engagement and success with the program. In contrast, alternative recovery programs such as Smart Recovery and Women for Sobriety offer secular frameworks that are more inclusive. The uniform structures of AA is another significant drawback. While some individuals may thrive in a structured environment, many others do not. Recovery is inherently personal, and a singular approach fails to account for the many circumstances an alcoholic may face, such as mental health conditions and social environments. Evidence shows that personalized treatment plans that consider an individual's specific needs lead to more successful recovery outcomes. Despite the criticisms levied against AA, proponents argue that it offers a life-saving framework for many individuals. They often cite success stories as evidence of AA's effectiveness. While evidence may be powerful, it lacks scientific evidence to support generalizability. Success stories may represent a minority of its participants, but it doesn't consider the many who struggle with the AA framework or do not find relief through its methods. Supporters also contend that AA's structure provides crucial support for individuals who feel isolated in their struggles. However, this assertion does not consider the myriads of alternative support networks that exist. Programs like Smart Recovery or even informal community support groups can offer the same benefits of connection and accountability without drawbacks associated with the AA spiritual framework. Some may argue that solely based on the popularity of AA, it is the most effective treatment for those dealing with alcoholic use disorders. AA is the most readily available treatment. However, availability doesn't always equate to its effectiveness. Popularity is based on cultural and societal factors, including the availability of AA meetings, social support, and the lack of alternative treatment options. It doesn't inherently validate the therapeutic success of the program. Case studies and comparative analysis have examined the comparisons between AA and other treatment options. Findings revealed that AA had a moderate rate of sobriety, while the CBT group demonstrated higher long-term success rates. In summary, while AA has played a significant role in the recovery landscape, its overall effectiveness is limited for many individuals. The lack of scientific and medical evidence, the spiritual framework that can alienate participants, and the one-size-fits-all nature of its program highlight significant drawbacks. Evidence-based alternatives such as cognitive behavioral therapy and secular support groups offer more personalized and effective treatments for alcohol dependency, leading to a higher success rate.